hypoglycemia. This is the blood sugar falls down and they get up with severe headaches. So that is post-alcohol headaches, and they will demand tea in the bed. Then there is a very common headache which people usually avoid talking about, is sex-induced headache. People have sex or they do a lot of hard work and they get these severe headaches, immediately, and it's really very disturbing. But we have to go into deeper history and then they come out with it. Similarly, people who endeavor a lot, they do physical hard work which they are not accustomed to, and they can get headaches. There is one headache which is drug-induced headache. These people who are addicted to taking painkillers for headache, those same painkillers can again give them headaches. This is also very common. So we call it drug-induced headache. Another common thing which we all see is a particular sort of spasm on the face. We call it trigeminal neuralgia, which most of you, I am sure, must have heard of. That person, you will see him, all the time massaging his face or a part of the head. And he will tell you that whenever I eat anything cold or hot, or if I sit near the window in a bus or train, or suddenly I drink water or wash my face with water, they get severe spasms. It's really very disturbing. But now we have got very good drugs and even surgery to completely treat that person. That person can be cured of it. Another common headache is a dental headache. Some people tend to grow a root of their tooth or a molar or a premolar right into the sinuses, and that actually is touching the nerve of this teeth, and that person gets spasms of headaches. Or somebody has got an infected tooth which wants to come out and is not able to come out very easily. They get these headaches. So those are dental headaches. Another common thing which we see is a temporomandibular joint arthritis. We call it TM arthritis. That is the joint of the jaw over here. And people do a lot of diagnosis, but it's basically a clinical thing. They do a lot of investigation and everything. But the moment you touch over here, they'll say, oh, I get a lot of pain. So we advise them not to chew from that side and eat very, very soft food for a few days, and the headache goes away. Then there are certain headaches which are sudden severe headaches. It's like a ball from the blue. You don't know really what's happening, and those headaches are very dangerous. One common cause is a sudden hemorrhage in the brain. People have got berry aneurysms. There are dilatation of arteries inside the brain, and suppose if that person is exerting, he's lifting some weight, or he's constipated, and he tries to pass through, the whole aneurysm ruptures, with severe headache and paralysis. So those are that is known as subarachnoid hemorrhage. And any kind of hemorrhage inside the skull or the brain can give this sudden headache. Similarly, in the same way, we have got this cerebral venous thrombosis or sinuses. There are sinuses or cracks of veins in the skull to carry away the blood. So these get thrombosed. There are blood clots inside, and these people get sudden headaches. And one is a cervical artery dissection. There is an artery, the main artery taking blood to the brain, and that artery ruptures or it gets dissected. It means the walls of the artery separates, and these people get these headaches. Third is any hemorrhagic stroke. An artery ruptures in the brain, and people get severe headache and they fall down. Similarly, we have got sudden or acute onset headaches, but which are not related to arteries, like sudden low pressure in the brain. Many people will come and tell you कि साहब रास्ते में चल रहा था, ऐसा चक्कर आने को लगा, फिर मैंने कुछ ठंडा पी लिया, and I started feeling good. That is, that history will tell you suddenly. Now medical books do not record this. They don't record this as a low pressure. But people will tell you that that's exactly what I felt, and when I had this cold drink, I started feeling better. Similarly, we have got something known as a hypertensive encephalopathy. The blood pressure in a person suddenly rises from, he is normal, say 140 by 80, and suddenly the blood pressure rises to 230, 240, and he gets the presence of throbbing headaches. So, medical fraternity sometimes do not recognize all these things. They say, we may go to simple doctors in low-lying area, and you get headaches, and you say, तुम्हारा blood pressure high हो गया, and you say अब चक्कर आते हैं तो तुम्हारा blood pressure low हो गया. It's not that. You have to actually diagnose because there are frequent causes. If it is there, what is there? It has to be diagnosed. Then there is something like an Arnold-Chiari malformation. That is, suddenly in some people who are genetically prone, the arteries and the veins join together in the brain and they start throbbing. These people get these sudden headaches. Ladies sometimes go to get an epidural injection for deliveries. You know, the pain, to reduce the pain in the delivery. So they get these lumbar puncture headaches. They say that okay, we had a delivery and with cesarean or with epidural anesthesia, and since then on we are getting these headaches. Some people get this herpes of the fourth nerve. You know, you get these all follicles and pustules over here, and after everything is over, they get attacks of headache for a long time. So you have to take history and diagnosis, and you will see that lady has got nothing now over here. She's clean, but she gets these headaches for a very long time. So this is post-herpetic neuralgia. Now, again we come back to our good old friend migraine. Now, as I told you, what is the pathophysiology of migraine? That these people collect metabolic end products, certain chemicals in the brain. Now, these migraine headaches, last from 4 to 72 hours. They are very disabling. That person has got mood changes. He is sensitive to light, to sound. He doesn't like children playing, the TV going on. And these migraine people are always, you will see, they are perfectionists. They get around with very few people. They want everything perfect. These people are, so we have to tell them, to be little lax in life. Then, even little children can get migraine, but in children sometimes headache is not the presenting feature. They come with vomiting and nausea and just dizziness. Many people suffer from vertigo and dizziness. Vertigo and dizziness are actually types of migraines, because nowadays this chemical theory of migraine is given up, and they say that migraine is a kind of epilepsy. That means there is an electrical discharge from one part of brain, and that is what causes this migraine headaches. The same way in these children, they get these types of symptoms of an epilepsy, but which comes as migraine headaches. Then there are two types. One is migraine with aura, as I told you, that people know that okay, now I will be getting these headaches, so let me cool down. And that is without with aura. And you know what they see in this aura? They get all visual distortions. They see something normal things which are abnormal. We call it as an Alice in Wonderland effect. They feel that they are dancing, or there are some unknown people and they are talking something nonsense. All this they get. And they suddenly start smelling some food which they dislike or like, or they see things which are not really normal. And they get rumbling in their stomach. So that is why this same thing is seen in epilepsy. So migraine is now classified also as a kind of epilepsy. Then most of the migraine are familial. You will always see that some other person, their grandmother or sister or somebody is suffering from migraine. So it is genetic and it is familial. We also see basilar migraine. That means migraine starts from the neck and then it involves the head. Or some people have got abdominal migraine. They just get cyclical vomiting. Again and again and again they go on vomiting after every 10 minutes. No headache. But they do not know why they are vomiting. There is no symptom of food poisoning, nothing. Then some people get confused. Confusional migraine. Or some people get migraine with stroke. When they get these headaches, one half of their body is paralyzed. Again they become alright. So these are all different presentations of migraine which a person has to keep in mind if he has to diagnose this problem. Migraine has got wonderful drugs now, but we start with simple drugs like paracetamol and domperidone. But now the wonder drugs are triptans. A lot of triptans, different kinds of triptans sold all over the world. But in India we usually get two types. One is sumatriptan and one is dizatriptan. But migraine drugs, any kind of drug when you want to sleep, it should be given before or as the migraine headache starts. If you give after about 6-7 hours, then it will not work so very well. So you have to be careful with that. We always ask these people to have lifestyle modification. They should have proper sleep, don't overwork. They should know their trigger factors. As I told you, red food, cabbages, certain kinds of vegetables, certain fruit, citrus fruit. So we ask them to avoid, and they themselves have to find out what is causing this problem, and they should avoid those factors. And there should be these people, as I told you, that they are very sensitive. So you should explain them a process of change in their lives, which they can do it. I mean, some people are financially too stable, but they want a lot of things. They feel sensitive, oh, I don't have LCD TV or things like that. So you have to ask them to relax and be happy with whatever they are. And then we also ask them to change the diet, like short frequent meals, not large meals, no junk foods, lot of fluids, all activities in moderation, and avoid poor posture. All these are trigger factors for migraine. And I told you that the drug treatment of these migraines. Migraine usually comes in attacks. It can come once or twice a week, or once every month, once every 2 months. So we have got now wonderful drugs which can even prevent these attacks of migraine. And some of these drugs which we usually like to use are beta blockers, which is usually given for, I mean, they are different drugs for different purposes, but we use it in migraine. One is beta blockers for hypertension, cyclohexidine, which is an appetite stimulant, amitriptyline, which is an antidepressant, then valproate, which is basically for epilepsy, and flunarizine. It's a specific calcium channel blocker which is given for migraine. And sometimes acupuncture works very well for this. And sometimes, as I said, that migraine is more common in women. So the cause that we have found out many a times is hormonal changes. So these women, before they get their menses, or at the time of their menses, they get severe migraine. And we realize that when we give these women extra estrogen, because they are secreting less estrogen, they come out of this migraine. And the brother of this migraine is what we call as cluster headaches. Cluster headaches are usually seen in men. The presenting symptom is same, but the only surprising fact is this cluster headaches comes in sleep. If a person is sleeping, he is fine, and suddenly he gets up with the severe headaches. And especially if that person is alcoholic. If he has alcohol, for some reasons, he will get these cluster headaches. The only difference between cluster headache and migraine is, one is it is in men, and there is a lot of watering from eyes, nose, congestion. All these are which differentiate. Otherwise, the pathophysiology is same as migraine. So I wanted to talk a little deeper for little details about migraine and cluster headaches. But otherwise, I think I have covered most of the causes which affects normal people. There are other causes which are very, very rare, but we need not go into